Hey everyone, welcome back to the Moein podcast. I'm your host Liza, and this is our fourth episode in the body transformation series. We've already covered topics like body contouring, tummy tucks, and fat transfer, but today we're diving into something that's been taking the cosmetic world by storm: high definition liposuction, also known as HD lipo. It's precise, it's artistic, and the results, when done right, can be absolutely transformative. And who better to explain it than the expert himself? Dr. Moein, board-certified cosmetic surgeon based in Los Angeles. Welcome back, Dr. Moein.
Thank you, Liza. I'm happy to be here again. I love these conversations because they help people understand that cosmetic surgery isn't just about looks. It's about feeling confident and comfortable in your own skin. And HD liposuction is one of the most exciting procedures we have today for that purpose.
Let's jump right into it. Most people have heard of regular liposuction. How is HD liposuction different? What makes it high definition?
That's a great starting point. So traditional liposuction is primarily about reducing fat. We insert a cannula under the skin and suction out excess fat to create a smoother, leaner shape. It's effective, but it's a bit like painting with broad strokes. HD liposuction takes that concept much further. We use advanced technology, usually laser-assisted ultrasound liposuction, which allows us to selectively remove fat while preserving important structures like blood vessels, connective tissue, and skin-tightening fibers. This means we're not just taking fat out, we're sculpting. We're revealing the natural muscle lines, contours, and shadows that give the body an athletic, toned appearance. It's a more detailed, artistic, and three-dimensional approach. For example, on the abdomen, instead of simply flattening it, we define the vertical and horizontal lines that outline the abs. On the arms, we can highlight the triceps and biceps. So the goal is not just slimness, it's definition.
That sounds like precision work, almost like an artist sculpting marble.
Exactly. I often say we don't just remove fat, we sculpt it. It's about seeing the human body as a dynamic form. Every curve, every shadow matters. The beauty of HD liposuction lies in that combination of technology and artistry. It gives us control, gives the patient results that look natural and fit rather than artificial or overdone.
So who would be the ideal candidate for HD liposuction? I imagine it's not for everyone.
You're absolutely right. It's not for everyone. The ideal HD lipo candidate is someone who's already close to their ideal body weight, maybe within 10 to 15 pounds of it, but who has certain areas that don't respond to diet and exercise. For instance, someone might be working out regularly but can't quite get the definition in their abs, chest, or arms. Or maybe a woman wants a more sculpted waistline and a smoother contour around the hips. Another important factor is skin quality. HD lipo relies on the skin tightening back over the sculpted areas, so good skin elasticity is key. If the skin is too loose or stretched out, we might need to combine HD lipo with a skin tightening procedure like Renuvion or even a tummy tuck in some cases. And finally, this procedure is not a weight loss solution. If someone wants to lose 40 or 50 pounds, they'll be better served by weight management first. HD liposuction is for refinement, for people who already have a foundation and want that finished look.
That's such a helpful distinction. Not weight loss, but definition. Now let's talk about what everyone wonders before a consultation: the cost. How much does HD liposuction typically cost, and why does it vary so much?
Yes, cost is always one of the first questions, and it's an important one. In Los Angeles, HD liposuction can range anywhere from $8,000 to $18,000 or more, depending on the number of areas, the complexity, and the patient's individual goals. The reason for the range is because HD lipo is a customized art form. For example, sculpting just the abdomen and waist might be on the lower end of that range. But if we're doing full body contouring, abdomen, chest, arms, flanks, and thighs, the cost naturally increases because of the precision, time, and expertise required. It's also worth noting that HD lipo takes more planning and execution than standard liposuction. We pre-plan the muscle highlights, mark the anatomy, and sometimes use 3D imaging to visualize the results. So you're not just paying for fat removal, you're investing in artistry, skill, and advanced technology.
That's a good point because the quality of the result really depends on the surgeon's expertise. Now, can you walk us through what happens during the procedure itself?
Of course, the procedure is typically performed under general anesthesia or twilight sedation, depending on the number of areas being treated. We start with very detailed preoperative markings. I literally draw a map on the body showing where fat will be removed and where we want shadows or definition to appear. Then we use Vaser ultrasound technology to break down the fat gently. The ultrasound energy liquefies the fat while leaving other important tissues intact. This allows for smoother, more precise sculpting and helps with skin retraction afterward. And next, I use small cannulas to remove the emulsified fat because the fat is already broken down. The process is much gentler, leading to less bruising and faster recovery. In some cases, we'll even take some of that purified fat and transfer it to other areas, like the glutes or chest, to enhance volume and balance the proportions. The entire process can take anywhere from 2 to 5 hours depending on the number of treated zones.
That's fascinating. It's almost like body architecture, adding and removing strategically. So what does the recovery look like? Is it painful? How long until patients can get back to normal activities?
Recovery with HD liposuction is actually quite manageable. Most patients can return to light activity or desk work within 3 to 5 days, which surprises a lot of people. You'll have some soreness, like after a tough workout, but it's not unbearable. We ask patients to wear a compression garment for several weeks. That helps reduce swelling, promotes skin contraction, and maintains the new shape full recovery, meaning the point when you can go back to intense workouts or heavy lifting usually takes about 4 to 6 weeks. It's also important to remember that HD liposuction results continue to evolve over time. You'll start seeing improvement after about 2 to 3 weeks, but the final definition typically appears after 3 to 6 months once swelling has completely resolved.
That's actually faster than I expected. And how long do the results last? Is it permanent?
The results are long-lasting, provided you maintain a stable weight. The fat cells we remove are gone permanently. They don't come back. However, if you gain significant weight after surgery, the remaining fat cells can still expand. The good news is, once patients see their sculpted results, they're often more motivated to maintain them. They eat better, exercise more consistently, and develop a healthier relationship with their body. So it becomes not just a cosmetic transformation, but often a lifestyle change.
That's inspiring. Now, before someone decides to get HD liposuction, what are the key things they should consider?
Great question. There are a few essential points. Do it for yourself. Don't let social media trends or outside pressure dictate your choice. You should want this for you because you want to look and feel your best. Choose a qualified surgeon. Always go with a board-certified cosmetic or plastic surgeon who has specific experience in HD liposuction. This is a complex, artistic procedure. Not every surgeon performs it or understands its nuances. Have realistic expectations. HD lipo can dramatically enhance your shape, but it's not going to turn you into a different person. Think of it as refining your natural anatomy, bringing out the best version of you. Commit to maintenance. After surgery, you'll need to stay active, eat healthy, and follow the post-op plan closely. That's how you lock in long-term results. And finally, have an open and honest consultation. That's where we discuss goals, evaluate candidacy, and make sure it's the right fit both physically and mentally.
That's incredibly valuable advice. And I love that you emphasize mindset just as much as the physical side.
Yes, mindset is everything. When patients approach surgery with realistic expectations and a healthy perspective, they're happier, more confident, and more satisfied with their outcomes. Cosmetic surgery should always empower, never pressure the patient.
That's such a strong message to end on. So, to sum it up, HD liposuction is a highly detailed, artistic body sculpting procedure, best for patients who are close to their goal weight and want muscle definition, tighter contours, and a more athletic look.
Exactly, Liza. It's the perfect option for someone who's done the work, they've been exercising, eating well, but they just can't get that final refinement. It reveals the best version of your physique.
Beautifully said. Thank you again, Dr. Moein, for walking us through every detail of HD liposuction. I think our listeners now have a much clearer understanding of what to expect before, during, and after surgery.
Thank you, Liza. It's always a pleasure. I love educating people about their options and helping them make informed, confident decisions.
And that wraps up episode 4 of the Moein podcast. If you found today's episode helpful, don't forget to follow, share, and leave a review. We'll be back next week with episode 5, where we'll discuss body fat transfer and how it complements HD liposuction. Until then, stay confident, stay curious, and take care of yourself.